Welcome to your weekly checkup. This is Dr. Lazar. Jaden is off tonight, but we're going to have a great show anyway. She's off for the evening, but we'll be back next week. So, herniated discs. What's up with that? That is what we're talking about tonight. And super excited to have you with me tonight for your weekly checkup. I'm Dr. Lazar, and tonight we're diving deep into a very common issue that affects millions of people. That's herniated discs. It's one of the leading causes of back pain and can severely impact quality of life. Tonight, we're going to discuss what herniated discs are, common treatment options, and then we're going to focus on something you won't hear often in the mainstream, the power of quantum spinal mechanics, or QSM3 chiropractic care. We'll also look at natural treatment methods and some orthomolecular supplements that support spinal health and make recovery better from disc injuries. So stick around for an information-packed hour. If this is the first time you're listening, welcome. So glad you're here. This is a show that is the authority on true healthcare, not sick care, but healthcare, so you can reach your full God-given potential. Let's start with a quick overview. A herniated disc happens when the soft center of a spinal disc pushes through a crack in the tougher exterior casing of the disc. Think of it like a bacon-wrapped fillet. That often causes pain, numbness, weakness along the path of the affected nerves. So for many, it's a persistent issue, and that can greatly impact day-to-day life. If you've ever dealt with a herniated disc, you know exactly what I'm talking about. It's challenging for sure, to say the least. If this is something that affects you and you have questions about it, our number is 866-521-WELL, 866-521-9355. Taking your calls live. If you're joining us on social, welcome. Thank you so much for being here, and super honored to have you on the show with us tonight. So we appreciate it. If it weren't for you, we wouldn't have a show. So thank you for being here. If you have questions and you leave those on social, I'll do my best to get those, and I'll do my best to answer those. All right. So most conventional treatment options include medication. That's usually where people turn first. Pain relievers, anti-inflammatory drugs, muscle relaxants. These can help with symptoms, but as you know, they don't address the root cause of the issue. There's also physical therapy that's often recommended. PT can help strengthen the muscles around the spine, though that may not be enough for some patients. The other challenge with that is when the muscles are being strengthened and the spine being stabilized, in theory, that's an outstanding approach. The challenge is you don't want to strengthen or stabilize a misaligned structure. That's where we get into trouble. We don't want that out of order, because if that's out of order, then we're cementing in the problem. Of course, surgery is on the list when people are dealing with herniated discs. I probably get that question more than any other question when I'm helping somebody with herniated discs, and they'll ask, do I have to have surgery for this? And the answer is, hopefully not. We're going to do everything we can. What I can tell you is in 16 years, we've never had one patient have their first spine surgery. We've had a handful of patients have spine surgery, but none of them was their first. And I'll explain more about that as we get into the show more. But of course, when other options fail, surgery is considered. The problem is it's invasive and it comes with risks, and it has a variable success rate. We're going to talk tonight about Jane who underwent several surgeries. Now, a few studies indicate mixed results with surgery for herniated discs. According to a meta-analysis published in the Journal of Neurosurgery, success rates are modest and re-injury can occur. The other thing is when there's a surgical intervention that happens, it's not, unless it was trauma that happened directly to that area where the disc herniated. If it's surgery can help in that context, but if it's a global misalignment or breakdown involving more than just that area, surgery is not going to be corrective. And then you'll have to have multiple surgeries to address that. So you'll have one and then have to deal with healing from that. And then eventually above and below, the segments above and below in the spine will require surgical intervention as well. And so that's why they'll tell you, hey, you might have to have another surgery in 5 or 10 years. That's because that's how the body breaks down. So mixed results on surgeries. We've got some stories we're going to share about that, and also give you some stuff you can do to help address this on your own. We're going to take a short break. We'll be back right after this.
Do you constantly live with pain? Does getting out of bed seemingly take all of your energy? Are you just plain tired? Tired of searching for answers and tired of not living the life that God intended for you? Then you need to call 866-521-WELL and speak with Dr. Jonathan Lazar. Dr. Lazar is an upper cervical doctor who specializes in helping those who are in chronic pain. Call 866-521-WELL and make an appointment to visit Dr. Lazar's office in Ann Arbor. If you mention you heard about him on WMUZ, your first consultation will be absolutely free. That's 866-521-WELL. Also, you can go to Dr. Lazar's website at yourweeklycheckup.com.
Hi, this is Dr. Lazar. Did you know our patients were admitted to the hospital 60% less often for any reason than people who aren't coming in for care? 60% less hospital admissions. We think that is incredible, and we'd love to see if we can help you and your family. Our number is 866-521-WELL, 866-521-9355. You can also find us at yourweeklycheckup.com.
If you're tired of searching for solutions for your condition, make an appointment right now at 866-521-WELL or at yourweeklycheckup.com.
Mike is hot.
Welcome back to your weekly checkup. I'm Dr. Lazar, excited to be with you tonight talking about the options you have for herniated discs. If you or someone you know suffering with this content is going to be incredibly helpful for you, because I'm talking from experience, 16 years of experience working on exactly this issue. We can certainly help with a lot of trouble people are having. Now, I want to talk about quantum spinal mechanics, QSM3 chiropractic. It's a corrective approach. So thanks for staying with us. Now, I want to talk about this QSM3 chiropractic. It's a corrective method that stands apart from traditional chiropractic approaches. QSM3, or quantum spinal mechanics, is based on the principle of aligning the upper cervical spine with extreme precision. This part's really key. The goal isn't just pain relief, although that comes faster than anything I've ever seen. But the goal is to correct structural imbalances that are at the root of spinal problems, including herniated discs. While the upper cervical spine is correctly aligned, when that happens, it has an effect that trickles down and it balances out the tension throughout the entire spine. So what you can expect from that is the pressure that's causing the herniated discs, the biomechanical imbalances, the lack of tensegrity in the area, biotensegrity to be precise, makes it so these herniated discs happen. Herniation means bulging. And so the disc is bulging out the side. Now, think about if you have a stack of bricks and they're stacked on top of each other and they're stacked vertically and they're balanced. As long as they're balanced, everything will be fine. But imagine there's some water balloons or jelly donuts between those vertebra, between those bricks. If the bricks get off balance and start leaning at all, then the biomechanical forces on the body from gravity are going to cause the disc to bulge or shoot out the side. If we take a logical approach to this, how would you go about addressing that if you've got a bunch of bricks leaning and you don't have any other options? You don't know what's happening with it, but the bricks are leaning and you see some material kind of oozing out the side, for example. Wouldn't you restack those bricks? Wouldn't that be the way you approach it? Yet, when it comes to our bodies, we don't do it that way typically. Well, people will pop Tylenol or Advil or Motrin, or they'll stretch, or they'll sit in a hot tub or get a massage. All kinds of things to address the symptoms of it, but not addressing the cause of it. In every other area of your life, you look for cause. If the hot tub's leaking, you look for where that's coming from. You don't just fill it back up with water. If the check engine light comes on in the car, you don't put duct tape over it. You address it. Yet, when it comes to health, we often feel helpless and leave things to chance or to other people, other types of professionals, instead of working on assembling a team that can help with correction. So we do that in our office. We do coaching, one-on-one coaching, group coaching sessions. We do all kinds of things to help make sure you're getting to the cause of the issue. Now, how quantum spinal mechanics differs from conventional chiropractic is traditional methods focus on adjustments at the pain site, which can relieve symptoms temporarily. They often aren't going to solve the underlying alignment issues. Again, if these bricks are stacked, if you've got 7 bricks and they're not stacked properly, you don't go to the bottom brick. You work from the top down because that's where gravity's hitting it. And so our bodies work the same way. QSM3, though, uses these precise measurements and adjustments to restore your body's natural alignment, natural tensegrity. So that's not just addressing the symptoms at that point, that's actually addressing the cause of your problem. And anytime we get to the cause, the symptoms will take care of themselves. It's cause and effect. But if you target the effect and don't ever address the cause, the effect keeps coming back. A recent study published in Chiropractic and Manual Therapies showed that targeted upper cervical adjustments using QSM3 techniques provided substantial pain relief and functional improvement in herniated disc patients with fewer recurrences, meaning it wasn't coming back. That's huge. Now, this approach also helps reduce inflammation and stress on the affected nerves. Now we're talking about we're offering a holistic pathway to healing. That's huge. So quantum spinal mechanics, QSM3, We talk about that on our website. If you go to yourweeklycheckup.com, we talk about that there. You can get information there or at qsm3.com. But it's really, really important. I can't stress enough how important this is. Stick around. We're going to take a short break. And after the break, we're going to explore natural options and lifestyle options for managing herniated discs for those of you that are listening remotely or aren't in the Ann Arbor area. By the way, if you're listening in an area that's not in Southeast Michigan, we still are happy to help you find specialists that can help with this in your area. So happy to help in that regard. Our number is 866-521-WELL, 866-521-9355. And I'll take your calls live on the air. And if you have questions, you can leave the information with Joseph, our producer tonight, and then he'll get that to the team. Our team will get back with you within 48 hours with an answer. We'd love to help. That's the reason we're here. 866-521-WELL, 866-521-9355. Stick around. We'll be back right after this. Hi, this is Dr. Lazar. Did you know our patients were admitted to the hospital 60% less often for any reason than people who aren't coming in for care? 60% less hospital admissions. We think that is incredible, and we'd love to see if we can help you and your family. Our number is 866-521-WELL, 866-521-9355. You can also find us at yourweeklycheckup.com. Hi, this is Dr. Lazar from Your Weekly Checkup, Tuesday nights at 9 on WMUZ. Did you know we offer a custom assessment where we can tell you after just one visit if your problem is fixable or not? That's right. In our Ann Arbor office, we'll offer you a complimentary consultation. And if we think you're a candidate for care, we'll discuss next steps for our custom assessment. That's a 13-point posture IQ assessment, hospital-grade digital x-rays with proprietary views, a 3-technology insight neurological scan, and a second-day custom doctor's report of findings. The complimentary consultation is the first part of that, and we'll discuss if you're a candidate for our custom assessment. Give us a call at 866-521-WELL, 866-521-9355.
Be on the radio. Call Dr. Lazar with your question now. 866-521-WELL. That's 866-521.
Mike's hot.
Welcome back to your weekly checkup. I'm Dr. Lazar, talking about herniated discs tonight. So we talked about some conventional options, things like medication, physical therapy, surgery. Then we talked about quantum spinal mechanics, QSM3, and how that is a corrective approach. Cannot stress that enough. Now, I want to move on to some other natural treatment options. Now, these can complement corrective chiropractic care. Many patients find relief and better healing outcomes by incorporating these methods. Exercise and movement obviously is huge. We say that motion is lotion. That's tweetable. Motion is lotion. Staying active with gentle stretching, core exercises, those can help stabilize the spine and reduce pressure on herniated disc. A study from the American Journal of Physical Medicine and Rehabilitation emphasizes the benefits of core strengthening exercises in preventing disc re-injury. So getting aligned properly is the only thing that's going to fix it, but it's important to work on core strengthening so re-injury doesn't occur. That's huge. Probably the most effective approach I've ever seen besides balancing out the spine is soft wave tissue regenerative technology. It's a form of stem cell activation, and I have never seen somebody people respond as quickly to something as they do with this. We have people that travel from all over the world to come in for our care in general. And this TRT, tissue regenerative technology, this device we're using out of Germany, is taking the world by storm. It literally is. And I can say that because it's not mine. I mean, we offer it and we pride ourselves on finding and offering the best available, best technology, best services, best protocols, all of those. But that is remarkable. And what we do is we do a thorough evaluation to figure out what the best approach is, right? Because it's not one size fits all. Some people need structural realignment. Some people need nerves unpinched. Some people need acoustic waves going in the area. Some people need high intensity laser, which is my next point. Laser's been around for several years, and I know on WMUZ you'll hear about this a lot, about laser therapy. We have an incredibly cool service line in our office, high intensity laser therapy. It's a class 4 laser, physician led, really, really a cool help for people that are looking for help. So QSM3, quantum spinal mechanics, is the most corrective I've ever seen. Exercise and movement, those are things you can do on your own. Tissue regenerative technology literally rebuilds the soft tissue in the area by activating stem cells. Really, really cool stuff. It helps a lot when we're using laser because that stimulates the production of ATP, the energy the cell needs. That's in the mitochondria of the cell. So this technology is kind of biohacking, but in a natural way. It's not overriding anything from the body. It's simply making it so your body is doing what it was designed to do. Questions on any of this, I would love to answer. 866-521-WELL, 866-521-9355. Acupuncture is really helpful. That's a traditional practice. It's often used for pain management, and it's shown some really positive effects in relieving back pain due to herniated discs. That was noted in a meta review in Pain Medicine. That was published in Pain Medicine. Acupuncture is very effective for that. We have people in our local community that we endorse. We like their work a lot, and really, really helpful. There also are some cool mind-body techniques. Reducing stress through medication. I'm sorry, not medication. Strike that. Reducing stress through meditation or mindfulness can also play a huge role. Chronic stress can exacerbate muscle tension, which indirectly affects the spine. On an earlier show a couple months ago, we talked about the biology of trauma, and Dr. Amy, who was our guest on that show, talked about how when trauma happens, we store things in our body. And so mind-body techniques can be helpful. And I fully endorse Biology of Trauma, that whole program. You can go to biologyoftrauma.com. You can talk about that, look into what's going on. But Dr. Amy takes people through this incredible work, and she teaches people how to do it on their own. So she's not building a dependency on certain types of care or certain procedures or going anywhere. Really, really, really helpful. So these lifestyle adjustments work well, very well in tandem with QSM3 adjustments. They don't replace the corrective nature of the adjustments, but they definitely help to reduce inflammation and prevent further disc problems. So super helpful. And we want to make sure that you're getting the information you need so you can make informed decisions, so you can get healthy, so you don't let your body hold you back, your nervous system interference hold you back, pain hold you back, structural misalignment holding you back. We don't want any of that. We want you to reach your full God-given potential. We don't want anything holding you back. We're going to take a short break. After this break, we're going to talk about some supplements that I like that will support the spine and disc health. So don't go anywhere. We'll be back right after this.
We hope you find the information on today's program to be inspiring If you've been told you have to live with pain or a chronic health problem, we encourage you to call 866-521-WELL and make an appointment with Dr. Lazar, the host of your weekly checkup. Dr. Jonathan Lazar is an upper cervical doctor who believes you can live the life God intended for you. The number again is 866-521-WELL. That's 866-521-WELL.
Hi, this is Dr. Lazar. Did you know our patients were admitted to the hospital 60% less often for any reason than people who aren't coming in for care? 60% less hospital admissions. We think that is incredible, and we'd love to see if we can help you and your family. Our number is 866-521-WELL, 866-521-9355. You can also find us at yourweeklycheckup.com.
Call and speak with Dr. Lazar at 866-521-WELL. That's 866-521-WE.
Mike's hot.
Welcome back to your weekly checkup. I'm Dr. Lazar. Jaden is off tonight, so you have to tell her this is the best show you've heard in a long time. That's what we're after. You got to tell her it's the best show you've heard in a long time. So the soft tissue support pack is a product that we have in our office, and it provides nutritional support. It supports the function, the recovery, the repair of your connective tissue. And when you have herniated discs, that is connective tissue. So that this support pack of supplements that we have, and we have those put together for you, it maintains the normal inflammatory balance. And so this will help alleviate muscle soreness, muscle spasm. It'll promote muscle relaxation, which is really helpful. Inflammation is a natural part of the body's immune response. It's a cascade triggered to protect your body and maintain normal tissue repair. Soft tissue support pack that we use provides a full spectrum of botanicals, enzymes, micronutrients, and other factors to maintain normal inflammatory balance and address connective tissue discomfort. The soft tissue support pack has 4 different types of supplements with it, and it's really, really a phenomenal approach. We have those in 9 packets that you can use. They're blister packs, or 30 counts. You can use those. Really, really helpful. If you have questions on that, definitely let us know. 866-521-WELL, 866-521-9355. Now, some of the things in our support pack, it includes a complete turmeric matrix. There's research on turmeric that shows that additional bioactives in turmeric have additional benefits, and those enhance bioavailability. Super important. And the complete turmeric matrix, or CTM, that's in our support pack, it includes compounds from the entire turmeric root, and those all work together as nature intended to deliver better results. This formulation contains standardized amounts of 45 to 55% curcuminoids, 2 to 6% turmeric protein, 3 to 8% volatile oil, and some other components make it the whole turmeric root. And this is included in the soft tissue support pack. This plays a really crucial role in maintaining inflammatory balance, and that helps with a variety of tissues due to molecularly there's a property. MAPK is a property, and then NFK beta modulating properties. That stuff doesn't matter, but I'm saying that I was talking to a gentleman in Atlanta a couple of weeks ago who's a molecular biologist, and we were kind of geeking out. Studies show that this complete turmeric matrix supports balanced inflammation in the joints and in the GI tract. That part's really important, because if the GI tract isn't, your gastrointestinal tract isn't functioning properly, you're not going to be able to absorb the nutrients anyway. We also use some proteolytic enzymes. Soft tissue requires that there are enzymes, and so these provide powerful enzymes: bromelain, trypsin, amylase, lipase, lysozyme, cellulose, peptidase. I think there's alpha chymotryptin, something. I'm pretty sure that's in there. That combination has been used for years in Europe as part of a multidimensional approach for tissue repair and recovery. So that is super, super helpful. The third component in our soft tissue support pack is a lot of flavonoids. So cusarin, hesperidin complex, hibiscus flowers, rutin, those are all included in the support pack. Those help support healthy capillary permeability. When the capillaries are permeable, or things can pass through them, then you get oxygen and nutrient support. That leads to tendon stabilization in the body and improved ligament function. That part is really, really huge. And then the fourth component in our soft tissue support pack is GABA and glycine. So we combine those. Those are amino acids that impart neurotransmitter activity within the central nervous system. So GABA and glycine both have an inhibitory or calming effect on the central nervous system, and that promotes a sense of relaxation in the brain and the body by decreasing nerve cell overfiring. The good news with this is it's not blocking any nerve signals like a pain medication would, but it will decrease the nerve overfiring that happens in the central nervous system. That acts as a major inhibitory neurotransmitter. It promotes that working. GABA is the inhibitory neurotransmitter. That plus glycine will reduce the excitatory activity in the brain, and that results in decreased signals that trigger those muscle spasms. So this is getting to the firing of the nerves and how that is causing the nervous system to react. We address nervous system function and we measure that because we use surface EMG, electromyography, and that allows us to see where the nerves are pinched and how that's affecting muscle firing. So if we have a multi-prong approach, if we're affecting how the nerves are firing, and then we're also using nutritional support for this, now you're able to support the function, recovery, repair of the healthy tissue, the connective tissue in your spine. And so that will help with muscle soreness, muscle spasm. It'll promote muscle relaxation and maintains normal inflammatory balance. If you have questions about that, we would love to point you in the right direction, get you more information. Our number is 866-521-WELL, 866-521-9355. We're going to take a short break. We'll be back right after this. Hey, this is Dr. Lazar from Your Weekly Checkup on WMUZ, Tuesday nights at 9. You shouldn't waste a ton of money covering up symptoms. Whether or not you're in the Ann Arbor area or if you're one of our out-of-town members, our office and our team is a team you can count on. We dig to uncover what's going on with your body and determine whether we can help you or whether we need to find another type of specialist for you. Since every situation is different, we make sure we understand what's causing your trouble so we can help your body heal and thrive. That way, you can get back to enjoying your life again, for real this time. Schedule an appointment now by calling 866-521-9355, 866-521-WELL.
If you're tired of searching for solutions for your condition, make an appointment right now at 866-521-WELL or at yourweeklycheckup.com.
Mike's on.
Welcome back to Your Weekly Checkup, talking about herniated discs. Tonight, I'm Dr. Lazar. Jaden is off for the evening, and so you have to tell her this is the best show you've heard in a long time. Appreciate you tuning in. So I talked about our supplement, our soft tissue support kit. That's the best I've seen. If you want to look into supplementation on your own, things you might have at home, in the meantime, those can support spinal health. Um, it's helpful because you can use substances the body naturally uses at levels that can help correct imbalances. So the supplements I recommend if you're going to do things on your own. Now, I recommend that these are clinical grade and pure. I do not ever, ever, ever recommend that you buy these off the shelf somewhere. There's way too much uh, risk for what's in those and the purity of them. They're made overseas. It's not good. I don't recommend those. Even if there weren't risks, the challenge is you're spending money on products that aren't required to be pure. And so there's no telling what you're getting in those, what the fillers are. So you've got to have clinical grade stuff. If you can get it from somebody other than a doctor, there's way too much risk. So the products that we use are designed to, they're only available through a clinician. You can't go buy them somewhere. And so that's how they control the quality of them, make sure they're pure, and that it's regulated that way, because they know we're not going to distribute stuff that's not quality. So some of the supplements I recommend: omega-3 fatty acids. Those are found in fish oils. Those have anti-inflammatory properties that can reduce inflammation around the affected nerve, which is helpful, or nerves. A study in the American Journal of Clinical Nutrition highlighted omega-3s and their impact on inflammation reduction. So omega-3s are good. Again, though, it's got to be, purity has to be high. It's got to be healthcare grade. I don't want you to go into a store, even a natural health food store, and buying these, because if if the fish have mercury in them or just any of those things, you're putting yourself at risk when you think you're helping. So let a clinician get those for you. Vitamin D, that's really essential for bone health. It's especially important for those with disc issues. And as the season gets darker, we're missing a lot of that sunlight we need anyway. And so for those with disc issues, vitamin D deficiency is linked to weakened spinal structures. And so one of the easiest ways you can do that is with a clinical grade vitamin D for purity. And we like vitamin D with K3, with vitamin K3. That has some other additional factors. Magnesium, that's huge. Magnesium is known to help with muscle relaxation. A lot of people are deficient in magnesium. There's one that we use in our office that is formulated so it can cross the blood-brain barrier better than any other type. Very, very powerful stuff. Magnesium is beneficial for patients with muscle tightness, spasms due to these spinal misalignments. Magnesium can help a lot. And then curcumin is another one. It's an active ingredient in turmeric. And so it's a powerful anti-inflammatory that's shown promise in reducing pain associated with disc problems. And there was a study, I believe that was published in Biofactors, was the publication, and talked about curcumin, which is in turmeric, how much that helped. Now, always check with your healthcare provider before starting a new supplement regimen. Now, that should be somebody who is trained in supplementation, not medication. Those are very different. We also have for people that want to be under care but aren't able to be in locally, we have options where we help people worldwide with analyzing lab work and making recommendations based on what we're seeing with that. And it's very, very effective, because not everybody can do everything. Like not every patient can do everything. There's not enough time in the day. But we have some really cool approaches for things in the office, things outside the office. And it's really, really becoming a cool thing, because we have different options that can address different causes, different needs, different availabilities, which is really, really cool. So we are going to take a short break. We'll be back right after this.
Do you constantly live with pain? Does getting out of bed seemingly take all of your energy? Are you just plain tired? Tired of searching for answers and tired of not living the life that God intended for you? Then you need to call 866-521-WELL and speak with Dr. Jonathan Lazar. Dr. Lazar is an upper cervical doctor who specializes in helping those who are in chronic pain. Call 866-521-WELL and make an appointment to visit Dr. Lazar's office in Ann Arbor. If you mention you heard about him on WMUZ, your first consultation will be absolutely free. That's 866-521-WELL. Also, you can go to Dr. Lazar's website at yourweeklycheckup.com.
Hi, this is Dr. Lazar. Did you know our patients were admitted to the hospital 60% less often for any reason than people who aren't coming in for care? 60% less hospital admissions. We think that is incredible, and we'd love to see if we can help you and your family. Our number is 866-521-WELL, 866-521-9355. You can also find us at yourweeklycheckup.com.
If you're tired of searching for solutions for your condition, make an appointment right now at 866-521-WELL or at yourweeklycheckup.com.
Open mic.
Welcome back to your weekly checkup. I'm Dr. Lazar. Jaden's off tonight. We're talking about herniated discs, and we've gone through quite a bit of information, and we do that because we want you to find value in listening to our show. If you're listening to it on WMUZ, if you're listening to it as our podcast, if you're on social streaming this, we want to make sure you're getting the information you need. One of the other things that can really help when people are dealing with herniated discs is collagen. Now, we have those in stick packs or powders or capsules, but collagen's the most abundant structural protein found in skin and connective tissues in the body. And so you've probably, unless you've been under a rock, you've heard of collagen. It's kind of everywhere. But over time, factors like age, lifestyle, genetics, previous injury, inflammation, biomechanical instability, those can all lead to breakdown of collagen and then slow the process of healthy collagen synthesis or creating new healthy collagen. The stick packs that we use, those include 3 clinically studied ingredients to support natural healing and maintain connective tissue structures. Most therapies simply block joint pain and connective tissue discomfort from exercise, and they'll do that, and that will then inhibit the regeneration and elongation of specific polysaccharide precursors, and then that depletes nutrients like magnesium, vitamin C, that maintain joint and connective tissue health. So when you're treating symptoms, you're actually depleting those precursors that are needed to actually heal. So we've got 3 components in our collagen, and that protects and preserves cartilage, tendons, ligaments, fascia, bone, and the intervertebral discs of the spine, those ones that herniate. So with ours, you use either one scoop if it's the powder, it's 8 grams, or one of the stick packs, and 8 ounces of water or whatever beverage you're drinking it in. It can also be added to food and baking products if you prefer that. So really, really helpful. If you do this correctly, this will protect and promote connective tissue biosynthesis. Your body will be generating its own. Also, this will support your body's self-repair process for cartilage, tendons, ligaments, fascia, bone, kind of important. It also will support joint lubrication and cushioning, which is super helpful. We don't want things to be rough, painful. It supports normal rejuvenation of healthy hair, skin, nails, and it maintains normal connective tissue inflammatory balance. That part's really big. So we're using a collagen hydrolysate. I say that wrong all the time. Hydrolysate. I have to slow down when I say that. The one we use, it's backed by more than 15 studies, and that provides highly concentrated bioactive collagen peptides. Those have been proven to stimulate the chondrocytes to produce proteoglycans and type 2 collagen in the body. This collagen has been hydrolyzed to provide short chain peptides, so your body can use that faster. And it's got a low molecular weight that allows the body to absorb it faster. And then the transport and accumulation within the target connective tissues is better because it's got that lower molecular weight. Each dose of our collagen will provide 5 grams of hypoallergenic protein, and that's in each serving. That part is really helpful. And then the lower dose in this decreases the excess oxalate production compared to higher dose collagen and gelatin products. Oxalates can cause issues with kidneys, and so we don't want high oxalate. So it's very important. Sometimes people think if they're going to take a bunch of, if one is good, 10 is better. And so if they're going to take a bunch of collagen, oxalate goes up. And so you've got to have the right ratio of those. Ours also includes hyaluronic acid extract. That's sourced from rooster comb. That's patented to provide the highest concentration of hyaluronic acid for easy absorption. Body can absorb that really easily when it's prepared this way. And the extract also contains collagen and polysaccharides to aid in the viscoelastic and lubricating properties of the hyaluronic acid. So you're literally lubricating the joints. Your body does it with hyaluronic acid, but if you're supplementing this, you're providing more of that. And then the third component is type 1 collagen. That's in the third component. And then the mucopolysaccharides are part of that. It's a combination of those two that provides the structural support to your tendons, ligaments, fascia, skin, bones. Everybody wants good skin, good fascia, good bones, tendons, ligaments. The molecular structure of this, those are key determinants in the ability of the connective tissues to endure the mechanical force that is required just being under gravity and fuel self-repair. So while collagen provides much of the structure and strength to connective tissue, this mucopolysaccharide component to it will help maintain structural integrity. It'll maintain lubrication, and it'll help the spacing of the collagen fibers. That's the part that's really key. Also, the mucopolysaccharides, those have been shown to increase collagen in non-collagenous protein synthesis. So you're developing other proteins in cultures of bovine tenocytes. So in cows, they've done this. And then in ligament fibroblasts. So things that are creating more ligaments in the body or stronger ligaments, hugely, hugely important. So we can't say enough good things about that. We want to make sure you're getting the right information, that you're getting the right care, you're getting the right products. That's super important. We're talking about herniated discs. Our number is 866-521-WELL, 866-521-9355. We're going to take a short break, and we'll be back right after this. Hi, this is Dr. Lazar from Your Weekly Checkup, Tuesday nights at 9 on WMUZ. Did you know we offer a custom assessment where we can tell you after just one visit if your problem is fixable or not? That's right. In our Ann Arbor office, we'll offer you a complimentary consultation. And if we think you're a candidate for care, we'll discuss next steps for our custom assessment. That's a 13-point posture IQ assessment, hospital-grade digital x-rays with proprietary views, a 3-technology Insight neurological scan, and a second-day custom doctor's report of findings. The complimentary consultation is the first part of that, and we'll discuss if you're a candidate for our custom assessment. Give us a call at 866-521-WELL, 866-521-9355.
Be on the radio. Call Dr. Lazar with your question now. 866-521-WELL. That's 866-521-W.
Mike is lava.
Welcome back to your weekly checkup, 866-521-WELL, 866-521-9355. So one of the questions that we got tonight was, what can you do to help with lymphatic system health? That's a great question, because it is, the lymph system is what drains the toxins. It gets the stuff out of the body that we don't want to keep in there. And so what we do with that, there are a couple of things. Getting adjusted is huge, because if your body framework is breaking down, then things are going to get jammed up, if you will. If you don't have a free flow of all the things in your body, then if they get jammed up, then that's not going to be very helpful. So want to make sure you're staying adjusted, want to make sure you're moving. Moving is really, really important, because the more you move, the more the lymph can move throughout your body. So that's huge. The other thing is lymphatic drainage, lymphatic massage. That can be very, very helpful. And that helps people tremendously to have that done. There are supplements that can be beneficial. It depends on specifically what it is you're after, what you're trying to do, but very, very helpful to have that, and make sure that the toxins in the body are clearing out. So herniated discs are a big deal. There's a lot of stuff you can do, though. You don't have to deal with, drugs if you don't want, surgery if you don't want, injections that have risks, associated with those. You don't have to do that. It's important to know that you have options. And one of the coolest things we've ever experienced is Jane's story. She had 3 herniated disc surgeries already, and was told she had to have a 4th. And she came in, we did an assessment on her. Our adjustments never pop, crack, or twist the spine. That makes it so your body's not having to respond to forceful or high velocity movements. And so when we adjust this way, we're balancing the spine out, we're unlocking the spine, we're doing it from the very top, which is hugely beneficial. And we're not twisting the spine, popping it, cracking it, anything like that. So Jane came in, and we got her measured, analyzed, nerve scans, x-rays, the full 9 yards, to make sure we have full picture of what's going on. And I've got to tell you, the one thing we're most proud of is the assessment we do, because we are looking at this from every angle. We're looking at it from biomechanical breakdown. We can do motion x-ray. It's very, very thorough. And so, think executive physical for the spine and nervous system. That's how I would describe what we're doing. So that's the approach we take. We want to get answers. Now, for WMUZ listeners, if you're listening on the radio, if you're listening to the podcast, if you're streaming this online, we offer a complimentary consultation with one of our doctors. That's a $224 value. We'll do a 15-point posture check. We'll go over that with you, see what options might be appropriate for next steps. And our promise is, if we can help you, we'll let you know that. And if we can't help you, we'll let you know that as well. And we'll help you find somebody who can. That's our commitment. So you're never going to waste time when you're interacting with us. We We may not be able to help you directly. There are some really specific things we can help with. And so when people have those things, we help really well with those. A lot of people don't have those things going on. And so we help find people that can help with that. Anyway, Jane had her spine surgeries, and then she came in after her third surgery. They said she had to have a fourth. And within 6 weeks of starting care, she was off all nine gabapentin pills she was taking a day. Gabapentin and Neurontin are the same thing. She was taking 9 of those a day. I don't have any idea how she was able to do that and stay alive, but by the grace of God, she did. And full recovery. I mean, she just is. She never had to have another surgery. Didn't have to go to therapy. Didn't have to do any of the things she didn't want to do. She was able to get right back into the swing of things, and so that's huge. A big misconception people have about herniated discs and the type of work we do is that sometimes people are afraid that a chiropractor can make a herniated disc worse. Not with the right kind of care. It's actually not even possible when you approach it the way we're approaching it. There's literally zero risk in that getting any worse because we're addressing it. We also have those other procedures we can use in the office. The high intensity laser. We've got the supplement support, the soft tissue support pack. There's a lot of stuff we've got. We've got the stem cell work we're doing. So chances are, if you have something going on with herniated discs in the neck and the low back, we're going to be able to help you on some approach. And even if we can't, again, our promise is we'll help you find somebody who can. That's one of my favorite questions, is to ask people, hey, if there's any chance that we could help you by finding what's causing this and then helping you get back to the life you want to be living, if there's any chance we can do that, do you think we should at least find out? And that would be the question I ask you tonight. I appreciate you listening very much. Again, you've got to tell Jaden this was the best show ever, and get to rub it in her face. She was off tonight, so you have to say this was the best one. I think that'll be awesome to hear her doing that. All right, so we've talked about herniated discs. We've talked about some really cool supplements, talked about some products that can help you. Make sure with those supplements that you're getting those in a clinical setting, not over the counter at the store. Herniated discs are a big deal. We can help. That wraps up our show for tonight. Thanks for tuning in to learn more about herniated discs and the powerful options we have for both conventional and corrective care. Remember, if you or a loved one suffers from herniated discs, there are holistic ways to pursue relief and healing. In fact, it's the only way to correct it. If you want to learn more about QSM3 Chiropractic, please reach out to us. Our number is 866-521-WELL, 866-521-9355, or yourweeklycheckup.com. We serve you in Ann Arbor. We serve you with our coaching programs. We serve you on WMUZ and wherever you get your podcasts. We appreciate you listening on behalf of our team in Ann Arbor and our awesome team at WMUZ. Thank you for listening. We'll look forward to being back with you next week. God bless you.
It's 9 o'clock, and the WMUZ Life and Finance team is on the air. To make sure we're all headed in the right direction, we at WMUZ have assembled a team of experts. And every night, a different expert is here to give advice about the issues that impact your life.
We hope you find the information on today's program to be inspiring. If you've been told you have